is Dr. Arif, and I'm your tutor for today. On this channel, we simplify medical knowledge from surgery, medicine, ops, gynecology, obstetric, and related specialities so that learning medicine becomes easy and approachable for everyone. With that said, let's jump to today's session. Part 5 of the clinical anesthesiology and pain management. The today's learning objectives are fluid and blood replacement of a patient undergoing surgery during anesthesia. We will learn about fluid replacement. Underneath, we study maintenance fluid, fasting and NPO deficit, surgical and ongoing losses, and underneath the heading of blood replacement, we will learn about how much blood is in human body, estimation of amount of blood loss, and calculation of allowable blood loss. Now first we talk about fluid replacement. Why do we give IV fluids around anesthesia? Number one is to maintain intravascular volume to prevent hypotension during induction and maintain urine output and organ perfusion. Second aim of us giving IV fluid around anesthesia is replace surgical blood and fluid loss. Third is patient is NPO, so there is nil per us, so correct fasting deficit. We calculate intravenous fluid in three parts: maintenance fluid, fasting and NPO deficit, and surgical ongoing losses. Maintenance fluid is calculated by 4-to-1 rule. How is it? 4 milliliter per kilogram per hour of the IV fluid for the first 10 kg of the weight of patient. 2 milliliter per kg per hour for the next 10 kg weight of the patient, and 1 milliliter per kg per hour for the remaining weight of the patient in kilogram. Now there is an example. For instance, I want to calculate the maintenance fluid of 84 kilogram man. For first 10 kg I have to give 40 milliliter per hour. For the next 10 kg I give 20 milliliter per hour, and for the remaining weight of the patient in kilogram I give 64 milliliter per hour. So the maintenance will be, the total maintenance fluid per hour will be 124 milliliter per hour. Next is that I have to calculate the fasting or NPO deficit. Formula for the NPO calculation of NPO deficit is maintenance rate in 2 hours of fasting, and we apply 50-20-25 rule when the NPO deficit fluid is calculated. So for instance, if the maintenance fluid of 84 kilogram man is 124 milliliter per hour and we have kept patient on NPO for 8 hours, then NPO deficit is to 992 milliliter. So now this 992 milliliter is given to the patient by applying a rule of 50-20-25 rule. That is that we give 50% of the NPO deficit in the first hour, which is 496 milliliter, and then we give 25% of the NPO deficit in the second hour, which is 248 milliliter, and then we give the remaining 25% of the NPO deficit in the third hour, which is the same 248 milliliter. Now, how much fluid should be given for surgical or ongoing blood losses? For every 1 milliliter loss of blood, either you give 1 milliliter of colloid solution or 3 milliliter of crystalloid solution. We will discuss about colloid and crystalloid solutions along with some blood product in detail in our coming lectures. For instance, if a patient has lost 150 milliliter of blood, then we give either 450 milliliter of crystalloid or 150 milliliter of colloid solution. Total IV fluid that should be administered in a patient undergoing surgery who is 84 kilogram in weight. The maintenance IV fluid we calculated was 125 milliliter. NPO deficit in the first hour, which was consisting of 50% of the total NPO deficit we calculated, that was 496 milliliter. and this patient has lost 150 milliliter of blood, then we give 450 milliliter of ringer lactate. So the total IV fluid that we should administer in these 84 kilogram men undergoing surgery is 1070 milliliter. So now let's jump to blood replacement. Let's know about the total amount of blood present in body. Neonate has 68 milliliter blood per kg of body weight, while infant has 80 milliliter blood per kg, adult man has 75 milliliter blood per kg, and adult woman has 65 milliliter blood per kg of body weight. When will be the need for blood transfusion? If blood loss is more than 10 to 20% or hematocrit drops to 30%, then there is need for blood transfusion. How can we make a rough estimation of amount of blood lost? The most reliable test is measurement of hematocrit, but however you can also do some other rough estimation of blood lost, for instance measurement of fully soaked sponge or measurement of fully soaked laparotomy pad. But it is the better way is that you have to weigh sponge and laparotomy pad before and then after the surgery. Then you can also do the measurement of blood present inside the section bottle. Calculation of allowable blood loss means this is gonna be the amount of blood that I can allow the patient to lose, and it will not bring any hemodynamic instability. For example, a 92 kg female has hematocrit of 38%. How much blood loss will decrease hematocrit to 30%. Now I'm going to calculate the allowable blood loss, and if the blood loss is more than the allowable blood loss, then there will be need of blood transfusion. Normal blood volume of 92 kg female is 5,980 milliliter blood. Now RBC's volume at 38% hematocrit is 2,272.4 milliliter, and RBC's volume at 35% hematocrit is 2,093 milliliter. So RBC's volume lost is 179.4 milliliter, and allowable blood loss is 538.2 milliliter. So if blood loss is more than 538 milliliter, then there will be need of blood transfusion. So blood transfusion is given if blood loss is above 538.2 milliliter. For every 1 milliliter loss of blood, give 1 milliliter of blood as transfusion. So if they're above 538, if there are 200 ml of blood lost, then you have to give 200 ml of blood as transfusion. Thank you for being with me till the end of this video. Please watch the rest of the videos about the clinical anesthesiology and pain management. And if you want the note of this lecture or the rest of the lectures, you can download it from Udemy, or you can join my WhatsApp group, and there I will share the PDF of my notes. Have a good time and stay fit.